The latest numbers from Travis County shows another 192 cases of COVID-19. Right now, 480 people are in an Austin hospital. 158 are in the ICU and 110 are on ventilators. A very good evening to you. I'm Jennifer Sanders. The Austin Convention Center downtown is set to open this week as an alternate site to take in overflow patients from area hospitals strained by COVID-19. KXAN's Alyssa Gore tells us right now this has been in the works for quite a while now, but it's still unclear if patients will need to be moved in this week.
As of last week, Austin health leaders said the plan is to have the Austin Convention Center ready Tuesday as an alternate care site for people who are not critically ill. However, patients may not need to be brought to that site on day one.
When they start taking patients, that's largely up to the hospitals when they feel they can start. They need to start offloading patients.
And this alternate care site, which is also known as a field hospital, is reported to have enough room to care for 1,500 people. But demands are high right now for Austin medical professionals, both those in the hospital and those who might staff the convention center.
The folks in the hospital, and this includes the nurses and the respiratory therapists and the nursing assistants, as well as the physicians, everybody is a bit stressed, but managing.
Dr. John Abi-Khalid is a surgeon. He is also the president of the Travis County Medical Society. He says it's promising that Austin's hospitalization numbers have plateaued after a spike the past few weeks.
It's leveled off at a very high, busy level where the hospitals are very full, but not bursting at the seams. At least that's the impression I get.
To staff the Austin Field Hospital, health leaders say they will contract with staffing agencies and ask for extra resources from Texas and other states. The Travis County Medical Society also has a roster of volunteers, and Abi-Khalid says they could help at the field hospital too.
I am not aware of a specific plan to actually bring patients there yet because it's not needed yet. But if it does become needed and if those numbers start skyrocketing upwards again, then it will be ready.
To avoid overwhelming hospitals, Abi-Khalid urges the public to keep wearing masks and stay home when they're sick.
And so the most important thing people can do is stay healthy so that they don't have to go to the hospital.
Alyssa Gore, KXAN News.
Well, the three major Austin healthcare systems say that they work closely with state and local officials when evaluating capacity. Now, they referred us to an update they sent out on Thursday, which states that between the three healthcare systems, 74% of the hospital beds are occupied and 98% of the ICU beds are occupied as well.